Hi, and welcome to the Future of Dermatology podcast. I'm your host, Dr. Farah Kamangar, board certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us.
We are back for one of the most exciting episodes of the year. We have with us our amazing medical students who everyone knows really well because they've been on our podcast a lot in a lot of our events, and we're so lucky to have them. But we have Chandler Johnson and Payton Smith. And the reason today is so exciting is that in medical school, there's a lot of things you do, and they did an entire researcher last year, which were in some of our podcast episodes. A lot of it is leading up to figuring out what you want to do in residency and what type of doctor you want to be. And once you figure that out, then what are the logistics of getting to that residency? And we've also talked in the past about dermatology is one of, if not the hardest, it's one of the hardest residencies to get into, like in a ridiculous kind of way. I wish I could quantify it even further than that. It's really difficult and challenging because at this point you have the top of the crop. You took like the top of undergrads to get into med school, and then you took the top of those guys. And then it just gets like the competition just gets like everyone is excellent, which makes it just even harder. So now they're starting that journey of actually applying and going through it. And I'm so lucky that within their super busy year, they're making time to actually record some of this experience. So hopefully it can help others. And just, it's so fun every year for us to see what our med students end up doing, that we're actually going to get to chronologically see how they do it this year through the podcast. So I'm so excited to have you guys. So hi, Payton and Chandler. Do you guys want to just say a quick update about where you are now, what you're doing?
Absolutely. Thank you so much for that awesome introduction, Dr. Farah. It's so great to be back on the podcast with you all. I've really been looking forward to this podcast because it gives us the opportunity to share a little bit more about our journey through the application process to applying to dermatology residency. So Payton and we are in a really exciting point of time where we just submitted our ERAS applications. And for those who are listening and don't know what that is the residency application where you're applying for your intern year as well as the advanced physician to dermatology residencies. And at the same time, we've also been going through our fourth year rotations, our away rotations, our acting internship. So it's a very busy time of the year, but it's a very exciting time too. So we're happy to be here to tell listeners a little bit about what this process looks like, and also give tips to both the pre-med and medical student listeners on how to be successful on these away rotations, especially in dermatology. And a lot of these tips that we'll share will be relevant to rotations through other specialties too. But that's a little bit of what we can expect for this episode.
Yeah, and I am currently at Rush University in Chicago. I just finished my first week here, and I've also done one rotation at SUNY Downstate, and I had a blast there. I'm loving it here in Chicago. And Chandler, I think you're at University of Florida right now?
That's right. And I rotated at my home program at Medical College of Georgia at Augusta the previous month.
Oh, yeah. I can't forget I did my at University of Arkansas. So, yeah, I hope we can add some tips and tricks in this episode.
Absolutely. And I'll just kind of add that, like you guys mentioned, so the process is now, of course, you filled out this application, which might sometimes sound like a simple thing, but is really hard, right? This application takes a lot of hours and time to even just like fill in all the things you've done and, make it look its best. At the same time, you're doing like kind of live interviews almost. I mean, it's not the interviews yet, but they're called aways, where, of course, you do your home school always, and they should know you well by now because you've been there, you're you're their medical student. And then you do these aways where you go for usually 4 weeks, right? Like a month or so, maybe even shorter. I've heard some people will do like shorter 2-week away rotations, but you would go to like a different place. One, you get to see how that place is going, but then also they get to know you a little bit as well. So there's a lot of moving pieces in this period of time. But yeah, Chandler, you let me know where you want to start. There are so many pieces to this. I guess, should we start with the away rotations, and how did you guys even pick where to go and where to focus? Because away rotations, applications, you can maybe apply a little more broadly, but away rotations logistically, you have like not that many slots, right? And then you also have, then the program also has to have room for you. So that's like a whole process in itself, is figuring out your schedule with that.
Yes, I feel like that's one of the hardest parts of the process, honestly, given that all of our medical schools are operating on different schedules. I've been learning that everyone is really working with a different time frame, and then you have to correlate that with the openings that are available to apply to at these different programs. So there's the timing aspect, and then there's the aspect of choosing where you want to do your away rotations, and it takes a lot of research, seeing where you want to spend that time, because our time is so valuable. Because ideally, you're maybe doing 3 dermatology rotations. There are guidelines that some people adhere to based on if you have a home program or do not. For me, I decided to do 2 away rotations, and that fit best with my schedule based on when my research year ended as well, because my research year ended basically end of July. So I knew that I wanted to get those away rotations done earlier in the fall, and not wait till too late, just so that I would be sort of on the wave of applicants rotating through the program before ERAS was due. That was sort of my rationale. I am rotating a little bit later at my next program, but I think that's totally fine. That's what worked for me, and I was happy to get that spot to be able to visit the program. So those are some of the 2 aspects to look into: the timing, and then what is it about the program that resonates with your values, your interests, where you think that you could potentially be a good fit. What do you
And I
think,
would add to
Payton?
that, yeah, I definitely think you should look at programs that you think you would fit with. I also think you should balance that, and I'm sure Chandler would probably agree, like, it's good to apply broadly, just because the odds that your schedule will line up with their schedule, will line up with like everything that has to happen, is honestly pretty slim. And like, you have the months that you want, and there's 1,000 other people applying. And so I think it's really good to just say, like, okay, here are the schools that I'm interested in. I'm going to apply broadly. And then I think you can pretty easily, like, if you get an offer and you have like 2 weeks or something to decline it, I all the advice that I've been given from my mentors is it's totally okay if you're like, oh, that actually doesn't work anymore. They just move it on down to the next person. And so I don't think that anyone will hold you, like, in contempt because you turned down a rotation that was offered to you. Like, schedules change. I don't think they're going to remember that couldn't make it for whatever reason. So I think it's good to have options, just in case,
Yeah,
your schedule changes.
that's actually a great point, Peyton. And like logistically, it's probably the administrator in the program that's dealing with all of this. So I feel like even the attendings of the program wouldn't have even known that if you
Oh,
changed
yeah.
something around. So you're right, because there is in this process, I remember back in the day, you question everything. You're like, was I supposed to do that? Was I not supposed to cancel that? So you're right. Like, you just also has to just make it work so that you can bring your best as well. Because that's what they'll remember, is when you're there, were you exhausted because you just came off of like some other crazy rotation? Or but yes, I'd be curious again, like, so how do you guys approach your aways? How do you like pre-game? You're going to a place, how do you do your recon, get the info? Or in general, yeah, what have you found helpful?
I think your point about recon is so important. So one of the things that I like to do before a rotation, this goes for dermatology aways as well as any rotation, is reach out to anyone that I know that's gone on the rotation before, because knowledge really is power. And I think it's great when you have some insight as to how to approach the rotation, what to expect. And that in turn makes me a little bit less anxious about starting with a new group of people and maybe a new place. So I like to do recon and reach out to some people who maybe have rotated before. Of course, that's not always an option. Sometimes you'll be going to a new place, sight unseen, know nobody at all, and that can be a little bit more challenging. But in those instances, I really like to do my research about the program. Sometimes they have different areas on their websites that gives you insight as to what to expect on the rotation. Like, will there be a test at the end? Will you have to complete some modules during the rotation? Will you have to do a presentation? Are there some pathologies that you may need to research ahead of time? So I like to look at the website if there's not someone that I know personally that I've rotated.
Yeah, I would say definitely study some dermatology before you go. My motto is like, you know, you will use this for the rest of your life. So why not just learn it now? It will just make the rotation go more smoothly. You don't, you want to present your best. You want people to think that you actually are interested in dermatology and want to read about it on your own time. And then I would say I really didn't know anyone who had done either of the rotations, the away rotations that I had done. And so I was definitely going in, you know, not really knowing what to expect. But I think, like, looking back, just having like kind of a learner's mind, just saying like, I'm not going to put too much pressure on this. If, I'm just here to learn. I'm a med student. I haven't gone through residency. No one expects you to know everything, but just being like, hey, this is such an incredible opportunity to see dermatology, to learn dermatology. Like, every single second will be useful, because I'm going to do this, or I'm going to try to do this for the rest of my career. And so just, kind of having grace for yourself, and just, trying to soak up as much as you can. Because I think sometimes, you're tired, you just moved to a new city, and maybe you're not sleeping the best, but you can kind of like, it can be tempting to not like try to soak up every little bit of information that you can, but just having like a learner's approach to it.
Yeah, so
I
you bring up a really
completely agree.
good point, Payton. Yeah, because it's basically probably daunting to think, okay, you have to learn all of dermatology before this rotation. And you guys have a leg up on it because you have been, every day doing dermatology for the last year. So I feel like, if you're coming out of a fellowship like that, it's probably even less of a, because you've just absorbed so much, you've gone to so many conferences, written so much in dermatology, that some of that will become innate to you. But if you haven't done those things, you're totally right that I think as an attending, when you're with a medical student, you're really assessing them for their ability to be taught and to learn, because they're not expected to know actually any dermatology at that point. It's amazing when they do, but you just want to make sure it's like a nice person and they're open to feedback, and it's someone that you can train over the next 3 years. So I think that's what most attendings look for. There are a handful of attendings that will start asking a lot of questions and, like kind of get to your knowledge base, which is stressful. So it does happen. So the best prepared you can be, the better. I know myself, when I'm with medical students, I'm just assessing for how well will this person be a team player with the other residents? What's going to be their leadership style? How are our patients going to react to them? Because the rest is, if they're open to learning, we're going to teach them that. That's what residency is for. So I totally agree with you. But every once in a while, you will see someone that's going to ask you, your top 3 differentials. So I would say at the very least, know how to describe lesions. That's probably a common one, just to kind of know, your descriptions of, you see a red spot and you want to say the size and macule versus papule, erythematous, know your colors, erythematous, violaceous. So those are low hanging fruit that I think every med students should know, just how to describe things. And then maybe just a top few differentials doesn't hurt to have. But I think a lot of it is just being nice and being normal is like 90% of it, which sometimes you can almost, on some rotations, if you're shy, or because I've seen it happen to really good medical students, they're either shy or uncomfortable, or they're thinking, man, I should have looked up a fact. Then they start acting weird just because they're like, in this high stress situation. So I agree. I can't agree more, Payton, with just learnability, and then just be cool, man. It'll be fine. It'll be fine. That's the advice I would have for medical students. But again, there are places that will ask you a lot more questions. And you mentioned too, Chandler, a presentation. I think it's really cool if you have the opportunity to make a presentation or do like a quick case write up with an attending that for something that comes up. That's such an amazing way to also demonstrate your knowledge base. So that's also like a good thing to take advantage of.
Right. I feel like that's a great way to stand out. Sometimes in the rotations, like your curriculum or part of the requirements include that presentation, maybe on an interesting case or one of your experiences in dermatology. But I really like your point about if you saw something in clinic and maybe you wanted to go home and look it up, you could show that interest and that like yearning to learn and come back the next day and tell the attending what you had learned about it in a humble way. And I feel like that would reflect really, really well. And there's like definitely little ways that you can kind of stand out in a positive way. I think that's one good one. Another one that I've been taught at Medical College of Georgia is being involved in quality improvement projects, which I've really enjoyed. And I've taken that with me through other rotations too. And what I mean by that is sometimes in clinic, you'll want to give patients handouts. So instead of just going online and printing out like a stock one that was already created by a different organization, you can make it more targeted and tailored to the attending's preferences, maybe creating a handout about bacterial decolonization. That's what I had done before. Maybe even like melasma, like a more commonly seen pathology. So if you take the time to do that and like present them with a ready-made handout that they could use in their clinic and continue to copy and use, like they're never going to forget you because they're going to be like, oh, that Chandler girl, she made this handout, like she's really good. So that's another way to stand out and be remembered going forward in an application season when so many amazing candidates are coming through.
That's amazing advice, Chandler. And can I have some of those handouts? That's so helpful.
Oh,
because
sure.
I know the level of detail that Chandler's probably done them to as well. Of like those are going to be good, detailed, nicely written handouts.
She's putting that Canva subscription to work.
I was about to say Canva.
They're going to be beautiful. They're going to be beautiful. Absolutely. They're going to be, the graphic design will be beautiful. The content will be like executed to perfection. So maybe we'll publish some of those on DermPub as well. That's if you've collected like 5 or 10 of these by the end of the rotations, everyone could use these. And what else? What have you guys found helpful? What else have you done that you think? Any other major things that you found helpful while you've started, or now that you've been on these rotations? What do you think has kind of resonated most, or what advice has been the best?
I think something that I just have to say, because I feel like it's something that I wish I would have, like, I think I had heard this before, but I think it's maybe the most important thing for someone who just is like, coming to an away rotation, not really sure what to expect, but just telling yourself, like, kind of like you said, some people are more shy. That's got to go out the door. Not like you don't have to be talking, nonstop. But the most important thing I would say is introducing yourself to people. Like when you walk in a room and there are people that you have not met before, you need to go around and introduce yourself literally to every single person, unless they, a lot of times attendings and residents are really busy. They're, charting on patients, or maybe they're like in another conversation or something. But if you, and I'm telling you from my own mistakes, but if you just delay that even a little bit, then it can kind of come into this like awkward place where you're like, oh, I didn't introduce myself to that person, but they, I was introducing myself to someone else. And then so like maybe they know me, but they probably don't remember my name. Just introduce yourself to every single person. And like, if you even have a second to do it, like it's just something that you got to do, like throw your shyness out the window, then you can be normal. But after that first step is so important.
Totally agree. And that goes for like staff and nursing personnel as well, because I feel like, if you were to match at this program, you're going to be part of the whole team, and you want to treat everyone with that same amount of respect and get to know everyone equally, because I feel like your nursing staff and every one of the allied health professionals really does make or break the team. So I think building those relationships at the beginning really reflects super positively on you too. And then as you go through the rotation, I can't tell you how many times I've needed help collecting, materials for a punch biopsy. And like, they're going to be like, oh, she was really nice. Like, I want to help that girl because she treated me with so much respect. So I think that having that level of detail to your social interactions is a positive thing to do on these rotations too. So I'm really happy you brought that up, Payton.
Well, it's from our favorite book, How to Win Friends and Influence People. Like names are currency. And if you know someone's name, man, that will take you so far. And if you don't know someone's name, you've lost the game. Like you just stop now.
Yeah, you're just that's such a good point. So much of this like live in person away is just the social interactions. It's what impression you leave, and it's also the impression you take away because you might walk away from rotation and say that might not be the best place. So I always feel like it's a two-way, even though it seems like, oh, it's so hard to get in and med students should always be, like wanting to be anywhere at any time. There are certain fits that will be better fit for you. So the program also needs to be on their best behavior too. And Chandler, you bring up a really good point of saying hi to everyone. Because in our practice, even now, like we know everything. So if a patient is mean to our front staff, we will know that information. And I don't think people realize that. And of course, medical students aren't going to be mean to anyone, but there's just the fact that it proves that, everyone talks. So getting to know everybody on the team, the front desk, back desk, the MAs, medical assistants, the nurses. And a lot of times actually on some rotations, the nurses and MAs are the people who are going to save you because you might not know where something is, where you're supposed to be, which attending you're supposed to be with. And they're usually so nice and they just know. And they're like the people that they'll help you out the most. So, and then of course the
100%.
residents. Yeah. You want to know just everybody, on the team. And like you said, Payton, sometimes it's like really awkward if you've been in clinic for an hour, then you've kind of missed your shot. Like that happens with me now all the time with like my kids and their friends' moms. I'm like, man, it's like 3 months into the school year. I've lost my chance. You better get names right up front. And then somehow remember them. If you guys have good tricks for that. I'm really bad at that too. Just write it down, right?
Do what you
come up with, do what you gotta do. Because a lot of us do this right when someone is saying their name, our brain like just for that 1 second just stops working and then like restarts and it's like, wait, what was that?
I'll be like, oh, sorry, I gotta stop. I'm gonna write this down.
Yeah.
Continue because if
it's
you just
so
say your
true.
name to me, I will immediately forget it if I don't write it down. So.
This is so true. Like I think and we put so much emphasis on content, and I'm sure you guys have probably really good resources too that we'll get to in a sec, and we can always put them down below the show notes as well for like content of how to things to learn. But focusing on the social interactions is like key, right, for these rotations.
Yeah, and Chandler and I are from the South, so manners are of utmost importance to us. So we had to start the episode off with that.
Absolutely.
Yes.
And what else, guys? Do you have any specifics for, I know you in the past you talked about things like specialty clinics or if you're going to like a Mohs clinic, like any specific things for different scenarios?
I think one good thing to talk about is whenever you're involved in any sort of hands-on procedure, be it a biopsy, be it a surgery, I think that it's really important to pay close attention and be an active learner. So not just passively observing, be able to anticipate or forecast what the surgeon's next move would be, what the nurse's next move would be, just so you can maybe help. And instead of being in the way, be helpful. Of course, you'll have to read the room when it comes to things that are more hands-on because, these are maybe higher stakes. Maybe there's, an open wound involved and you're not going to want to be that med student that contaminates a sterile field or, drops the bandage. So I think that first being an active participant, like at least mentally being engaged is important. What else would you say about it, Payton?
Never go into a room that's like where they're doing a procedure or something and like immediately just go put on gloves because I don't think anyone will fault you for putting on gloves when you didn't really need to. But if they need you to hand them something or like need help, adjusting the patient or something and you're there with no gloves, like just put on your gloves.
Yes,
That's a
good
really
point.
good point too. I have fumbled with gloves many a times and you're like, I should have put them on earlier. It's a whole thing. And then so mimic what they do with hand sanitization. So some docs will walk in and they'll do the full, especially if it's a procedure, they'll do the full, scrub hands all the way up to their elbows. Others will just get hand sanitizer. So mimic them. And so you want to get the hygiene, exactly what your attending's level of comfort is, then probably not, maybe more, because if they're walking in and they think it's semi-sterile is fine and they're doing just hand sanitizer and you're back there like scrubbing away up to your elbows, that might be a mismatch. So, but again, nobody would fault you for that. But it's like, you just match the tone, like you said, situational awareness, never contaminate a sterile field. I feel like there's not that many no's, but I mean, that's like a, there's that one no. Don't contaminate his field. Yeah, that's a big one. And then just be situational awareness, because sometimes procedures will go between semi-sterile to fully sterile quickly, or in between rooms. So if they're wearing, just regular gloves in one, but then they're wearing the surgical sterile gloves in the next, like you want to match that. Look at where the sterile gloves are. It seems so simple, but sometimes in the middle they'll be like glove up, and you're like, where is it? And then look at where it is, kind of look at it, quickly see where your size is, know what your size is. Even go at half size up. It's almost better to get that glove on faster and you'll be fine. You'll be, because you're not doing like fine sutures or anything. You'll be fine a little bit. Just those minor things that will get you in there. If you can help a doc with hemostasis when it's necessary, you will be a hero. Like I remember once I was a med student and we were, for whatever reason, somebody was out of the room and the Mohs surgeon was operating, and then this just little blood vessel in the forehead just started going crazy. And like for whatever reason, I'd just come off of my ENT rotation. So I was like, and I just literally just put my finger down right on the blood vessel, like outside the surgical field. And he was like, whoa. And I was like, yeah. It was like a really like mic drop moment. It's so simple, right? Just putting pressure on a little vessel. But that stuff is like, it's just these like really easy things, but it just takes situational awareness. Like, where's the glove? Where's the thing? Where's the bleeder coming from? And you're just making that doc's, you're just making that doc's day easier.
What's that, Payton?
Yes.
You just want to have your goggles on, because anything you inject, or I actually just 2 days ago in a Mohs procedure had blood just squirted all over. But thank goodness I was wearing my goggles. So
yes, take
PPE
your PPE.
Is important.
Take your own PPE, and if you get covered in blood, act cool. It's not a problem, even though it's probably not cool. And we probably should be letting med students leave the room at that point and get blood off of them. But I don't know. We're a little bit of a medicine is like that.
Another note that I heard about PPE before, this is another like hot tip for med students, is, maybe pay attention to what glove size the resident or the surgeon wears, so they don't have to walk across the room. Like you can already like hand them their gloves. Like that's a really good way to kind of be part of the team, especially if it may be a procedure where you're not doing that fine suturing, or maybe you're just observing. That's a way to sort of make yourself useful in a situation where you're more hands off.
Yeah, you want to have the right size gloves. Just a few days ago, and it may have been the same procedure, but I had to put on sterile gloves, and all they had was like a 6 or something. I was like, it's been a while since I put on sterile gloves. It'll be fine. By the end of it, I could not feel my hands. I was like,
I wear a 6, Payton, and my hands are like baby hands.
I was like, they're blue, they're purple, and they're dying, and I can't say anything. So,
it's so true. It's these little things. Absolutely. And then hemostasis is just like probably, I think, the one place that med students really get in there. So, and help. So just understand that, right? If there's needles on the field, use the little Q-tips for hemostasis. Just these little things like, okay, this person knows what they're doing. So you're not just going in there with gauze and then stabbing yourself. And then now they have to deal with their med student got stabbed with a needle, just little things like that. So it makes big difference. difference in procedures. But yeah, these are really amazing tips. And so as we go through tips, I guess the next step is I'd love to it's the Future of Derm podcast. So we always ask about the future, but for you guys, I want to focus on the near future. So you'll get done with the away rotations. What are the next steps? What does the next year look like for you guys? Like, and even like very near, like what's next month like, and when do interviews start? Like, what's the timeline of when everything's going to happen now?
So for some people, interviews have already started because several rotations will have the interview incorporated into the rotation, and that's been my experience so far. But I anticipate, in the next month or so, having my first interviews for intern year programs, and then there's a scheduled release date for dermatology programs that happens in November, right, Payton?
Oh, yeah.
Right. We're going to nail down those timelines very soon, but one day at a time out here.
It's so true, isn't it? You're like, this week I'm on this away rotation, and then I'll focus on what's next week because there's so much coming at you guys this year.
Right,
Yeah.
and it's
what are we doing tomorrow?
Yep.
Goodness. So that's sort of like the near future, just getting those interviews, fingers crossed, and then scheduling them, which I know can be tough in itself, just making sure that I'm balancing that with my rotations that I'll be on. But that's what I'm looking forward to, just continuing to prepare for interviews. And maybe we could talk in a future episode about how to prepare best for interviews and a good approach for that. But
absolutely, that's our next segment. And what is the format now? I know for a while we were all live back in the day, and then it went to all Zoom, kind of online virtual interviews. What's the format now that you're seeing?
I think that there's going to be a mix. I'm not quite sure about dermatology rotation or interviews specifically. I know that some programs last year did in person, but I think it's a healthy mix. Same thing for intern year interviews. And then for these away rotations in person has been the trend so far.
That's interesting. Yeah. So it's kind of coming out of that COVID era now, because there was a few years where everything was just virtual.
Yeah, I'm hoping that a lot of them stay virtual. My friend, the research year, a lot of my friends already graduated, sad. But she applied ENT and all of her rotations were in person. And she was like trying to fly to,
hard.
however many, like over 10 different programs in the middle of winter, all the planes are delayed. It's holiday season. And if you miss your interview because the plane is like, they don't care. Like, they're not like, oh, yeah, well.
Yeah, you're not logistically difficult. And for us California folk, like I should say, well, not you guys, but for me coming from California, we were like driving in the snow and I was like, that's it. Everything else was okay, but this is now starting to be a deal breaker. But we still did. We drove through snow, got to the interview. But, it's a whole thing. It's some places it's really cold. Flights are delayed. It is like a big thing. But the fun thing is I hope they bring this back. There used to be New York week. I don't know if it exists still, but all the New York programs would have their interviews in 1 week, and like all the derm applicants would be in one place. It would just be like one giant party. So hopefully that comes back.
That sounds so fun.
That was really fun. It was usually towards the end. So that's fantastic, guys. Do you have any last minute advice as well? And like you said, we will do a few installments because we have to hear how the interviews go. We have to get your tips on that. Then the match day, you have to do your match, submit those applications. When is match day? Do we know yet? Or is that way too far? We'll deal with that when the time comes. It'll be March something.
Well, I actually think I might know this.
We'll fact check that.
21st. Am I totally off there, Chandler?
It's usually around
we're
that.
We're going to have to fact check.
We'll fact that. But you're right. That's like, you're right now. You're going a month at a time.
We have it together.
No, exactly. You guys do. No, I totally understand how you feel because it's always like that too. And then you have to take some steps in there too, right? There's some USMLE step action somewhere in is it step 2 now, or are you guys past all of that now? Or step 3? There was like done with step 2. It was step 3 to okay. Step no one cares as much about step 3. So there's some USMLEs there. And then you'll see residency will kind of be the same as well. Like you'll kind of start and there'll be different things that'll just, you kind of go month at a time. There's this test, there's this next thing. So it kind of doesn't end. I remember even towards end of residency, it was like graduation and then boards. And then we were like flying out for a wedding. And so it was like, okay, I'll worry about that then. So there's always this mindset of like, there's so much coming at you that you can only focus on the next 6 to 8 weeks at any given time.
Right.
Yeah.
Well, thank you both so much.
So
this
nice
has been amazing. Yeah. Any last minute advice or anything else you want to just leave off with?
Or Chandler, do you have something you want to start?
Yeah, I have something really, really small, but honestly really meaningful to me. It's just always be yourself on these rotations. Just be authentic at the end of the day, because I mean, you want them to like you as who you are. So when you show up as your first day as a resident, they're not like, who is this person? This is not the person who rotated. So I think it's important to be authentic and just like show up as you are. Maybe amp up your extroverted side just a little bit so they can get to know you a little bit better. But that's really my main thing. Just be yourself.
Yeah, I think mine is kind of similar in that you don't want to kind of lose yourself in this whole process. Like I think it's really important to like take care of yourself during these things because, like we didn't really talk about this, but I think, like transportation is kind of huge. Like right now I'm living kind of far away from the hospital. And so like, I'm like transporting for like an hour and a half just one way. And so sleep is so important. I'm a little sleep deprived right now. And I'm like, okay, we're going to fix that in the next couple of weeks. But like taking care of yourself, trying to make time to enjoy your life now that ERAS is over, hopefully we will all be doing a little more of that. But if you're just like, dead on the inside and sleep deprived, you're not going to be fun to be around. So take care of yourself for you, but also for everyone that's around you. They will probably really appreciate it.
That's great advice. And really just getting those, even as a med student, undergrad, resident, getting those early self-care skills, because it's not going to end. There's always this thought that like, well, the next step it's going to be easier, and it isn't. It always gets harder. I shouldn't say that to you guys now. You should be in the hopeful, happy state, but you get to residency and you get to practice and it gets harder and harder. So if you don't build these tools in now of self-care, sometimes burnout happens, and we see that happening with docs, and the numbers are rising. So I love that. I think that's the takeaway. If nothing else, take care of yourselves throughout this process, because it can be a lot. But you guys are going to do amazing, and I'm so excited for this year. I'm so excited for match day, date TBD, but we're going to be excited for that day, and I can't wait to have you guys back wherever you can fit it in, because you're going to be so busy the next few months. We'd love to, middle of interviews, see how it's going, after match season, see how it's going. But thank you guys.
We love SFDS and the future of dermatology. I know that Chandler and I put it all over our application because it's just so fun to talk about.
Yeah, you guys are amazing. And you can't leave either. We're going to rope you back into SFDS every possible chance we can get. So
we don't want to go. We're staying.
Love it. Well, thank you guys.
Thank you so much.
Bye.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.